On September 15, 2017, the Agency for Healthcare Research and Quality, or AHRQ, brought together key stakeholders, representatives of health delivery systems, small and medium-sized practices, researchers, and AHRQ staff to convene the agency's first research summit on learning health systems. AHRQ Director Gopal Khanna.
I believe we are sitting on opportunities that are really huge. And that's the reason why I thought it would be a very good idea to have our stakeholders come to us and we can work with them and learn from them.
The summit focused on achieving 3 goals. First, identifying the aspects of learning health systems needed to improve organizational performance and quality and safety of care, as well as important characteristics of the healthcare workforce. Second, recognizing attendees' roles in helping to create a learning health system. And third, exploring how AHRQ can act as a catalyst for the advancement of learning health organizations and practices. Throughout the summit, attendees participated in interactive panel discussions, moderated group exercises, and a variety of fast-paced brainstorming activities. They shared stories about challenges unique to their organizations, and many they had in common. During the session, Learning Healthcare Delivery Systems in Practice, Lucy Savitz, Karen Feinstein, and Peter Pronovost delved into issues like these and many others. As moderator, Karen Feinstein of the Jewish Healthcare Foundation probed on questions about improvements, harm, and organizational culture. Dr. Peter Pronovost of the Johns Hopkins School of Medicine shares his perspective.
Well, healthcare has a number of improvements to do. We harm too often, we cost too much, we often disrespect patients. The way we improve that is through being a learning health system, by making sure we're constantly seeking to get better, to find that new knowledge that allows us to get better, and most importantly, make sure we apply that in the care of our patients.
Lucy Savitz from Kaiser Permanente Northwest offers further insight.
There has to be commitment from senior leadership that they truly want to be a learning healthcare system. And that requires not just in words making that attestation, it also includes really investing in the capacity and the resources necessary to make that happen, whether they do that internally or they collaborate with external partners to make that happen. And the other thing that I think is really critical that gets really short-shrifted in all of this is creating the culture. There's a National Academy of Medicine paper out, Rich Platt's the lead author right now, where they're talking about creating a culture of inquiry, so that people begin to ask the questions.
Dr. Mary Naylor of the University of Pennsylvania School of Medicine and Dr. J. Michael McGinnis of the National Academy of Medicine offered perspectives on their vision for learning health systems.
I see in the last couple of years one really solid example of where advances have been made, and that is in the partnerships that now exist. And I'm sure they always existed, but in the alignment of the goals and agendas of the National Academy of Medicine and AHRQ and all of the other organizations really converging, coalescing around a common shared agenda to get to better health, better health care, and better outcomes for people in our society. So it's been tremendously exciting for me to have a chance to sit in many of these spots to hear about the work of so many.
Well, I agree with your observation about the importance of stakeholder synergy and what we see now. We see new partnerships being developed, we see a new appreciation for the opportunities, and we see a commitment to work together to try to capture those opportunities, which is a reflection of a couple of things, well, many things, but one is the urgency of the issues involved. When we see missed opportunities to improve the health of people who are most vulnerable, when we see the costs of care continuing to rise and at the expense of many of the social services that are necessary to make a difference. When we see a clinician community that, because it's working in a culture that at this point hasn't been able to take advantage of the appreciation about team care and about engagement with patients and families. We are in a circumstance of deep societal obligation to make these changes. That's why I think you see a different spirit about the importance of working together to capture what we know is possible in developing a continuous learning health system.
For attendees, presenters, and staff, honing in on the opportunities and capturing the possibilities to achieve the transformative for learning health systems now and into the future, aligned with each of the 3 goals AHRQ set out to accomplish. And as discussions among agency stakeholders and staff continued into the afternoon, new ideas began to emerge, resulting in clearer and more unified concepts, like ones noted by AHRQ Chief Medical Officer Dr. David Meyers.
The learning healthcare system has, in my mind, 3 components, and we really heard focus on 2 of them today jumping out, or at least that's what I heard. So one, as you said, is taking the evidence that's coming from the academic health centers, from health services researchers, from outside of healthcare, and bringing it in. That's what we've done for years. But what was new about today's discussion, 2 parts. One was how healthcare systems who are caring for patients every day can learn to care for tomorrow's patients because of what happened today.
Karen Feinstein summarizes what she and others agreed as essential in building a successful learning healthcare system.
Well, I was very reassured at this meeting. We took a vote on what is the most important factor in having a successful learning organization, and far and away the most popular criteria were leadership, a champion in every unit. That means training is ongoing. So I think that people named all the key components. You've got to have real-time data, credible real-time data drilled down to the unit and practice level.
Such sentiments resonated with many participants. Having heard the thoughts and ideas of panelists and attendees, agency leaders reflect on how AHRQ might serve as a catalyst for the advancement of learning healthcare organizations and practices.
I think there is a need for AHRQ to leverage its competencies, which are really very significant, and provide greater value for the community at large, physicians, clinicians, and ultimately the patients and the American people.
I think when it comes to tools and resources, they want to understand a lot more about how to spread and scale new findings, new investments. How do they know what to replicate and how to replicate it and how to evaluate success? And so I think that's something we can certainly focus on.
Using all of the information they're generating, all the experience they're gaining, their own and what we call data, and turning that data into knowledge to improve healthcare in the future. That was never before possible.
The agency was able to achieve the goals outlined for the summit thanks to the valuable input from all who participated. As a result, AHRQ is putting in place plans to support learning healthcare systems to further embrace the power of their own data and people.
So I think we got a lot of great ideas, and I think one of the most important concepts was how AHRQ could be a convener of other public agencies and private agencies, other government agencies that have some work in this space, and private entities. So I look forward to working with lots of others.
So yes, we do have a lot of structural issues at play. However, the opportunity is that we can create tipping point by design, because when these forces are at play, can we do something transformative? And I believe so we can.